there's a very famous joke, as you know, if you know, the symphony orchestra was taken to Sivas, and and so how did you like the symphony orchestra? They said, and so and as during the history of the Sivas, it was the most torturing event that has happened in Sivas, they said. So after we have expanded our minds with the so of course we need 10 days in order to digest what we have heard already. And I have decided to make my presentation next year. Therefore, I will be only taking 10 minutes of your time in order to just give a hook. And next year, I think, so we will be able to uh, discuss about it. These are all my cases actually, and so three of them I have seen in my clinics in Marmara Clinic, and so actually when his boss son died, uh, and the 27 years old maid, and who previously had an obsession of did I kill him when his boss son died, developed an obsession of did I have a sexual intercourse with the person who sold the car to me, after the mechanic said to him that you motherfucker, after buying and selling a car. And he cannot walk through the street and neighborhood of that person. He constantly thinks of himself in a sexual position. He is almost certain of it and feels ashamed. He says that the repairman spoke like that because he was in a relationship with this person, and he wouldn't have spoken like that otherwise. This obsession bothers him all day long. Sexual images that he cannot get rid of constantly comes to his mind, and he doesn't remember experiencing something like this, but still he cannot stop himself thinking about it. He can't go to the work in time. He goes out on the streets, and but he cannot continue his life. He has delusions of reference, and the people are talking about, he thinks that the people are talking about it, and knows about the situation. The second case, and actually it's a computer and so it's a 35 years old computer. He has been able to do his job for at least 8 years. He sits at home. He thinks that if he goes out, a big penis will stab him in the back. And even at home, he walks by leaning against a wall, covering his back with his hands. He says that he knows it is ridiculous, but he still believes it is possible. On the rare occasions he has to go out, he takes precautions and walks by leaning against the wall. The patient develops a persecutory situation centered on this obsession, and thinks that he will be harmed in this way. And third case,
Değişim öyküsünde bağımlı kişilik bozukluğu özellikleri sergileyen 33 yaşındaki üniversite mezunu kadın hasta,
and
çeşitli mizah hezeyanlar ve çok renkli işitsel filmler
33 years old university graduate female patient whose development history shows features of dependent irrational disorder, has a psychotic episode characterized by various bizarre delusions and multicolored auditory visual hallucinations. She constantly watches over her elderly mother, fearing that she will have a sexual intercourse with the neighbors, her brother, or even other women who come to visit her. After a while, she cannot even stand being separate from her, and begins to spend the whole day at her with her mother. She is in bed with her and doesn't allow her to leave her to even when to pray, and she keeps the door open while she was bathing. And she questioned about this language, and she said that she didn't find it possible because if her mom had sexual intercourse with some of them in front of the guests, the others would react and shout and scream. And since no one else had reacted in this way, she could have answered it.
Antipsikotik tedavi
And so when the antipsychotic treatment is stopped, patients' previous uh, functional symptoms are exacerbated, and it's provided again with treatment and uh,
idare edebiliriz bu çalışmaları. 31 yaşında
and
makine mühendisi
another male,
İngiltere'den
31 years old male, mechanical engineer, and the thought I raped XXXX comes to his mind unintentionally. This name changes. Sometimes it's a famous person, sometimes it is someone from the circle of his acquaintances. He is disturbed by his thought and he knows that it is not real, but he says it cannot be a crime to think it. And
herkesin
and
bildiği
however, the
düşünceleri
patient who has delusions that everyone's thoughts are being read by the police and the intelligence, and he is worried that police will hear his obsessions and they will think that it is real and the legal actions will be taken against him and he will be arrested. He constantly checks if there are any lawsuits filed against him, and sometimes he goes to the courthouse not trusting electronic systems. For this reason, a legal action was taken against him for keeping the institution busy. When he is not sure that legal actions will not be taken against him, his anxiety increases a lot, and at a time when his anxiety becomes unbearable, he attempts suicide by jumping from hate, a life-threatening attempt. And again, another another case, 24 years old male electric engineers, and he has memories from the past he cannot remember and fills in the gaps with even that it didn't happen. And he has a religious obsession such as reciting the wrong prayer during the prayer, not being able to perform the ablution adequately. He has been performing prayers lasting more than 3 hours and performing ablution repeatedly due to these thoughts. And he says, I was chosen by the God, he says. And actually, these are these cases, and this case has been taking my consideration for more than a decade, and we have also shared this case in several in several cases, and actually I sincerely believe that it needs to be taken, and I will try to make a very brief summary in my remaining time, and it is my mistake by the way, and so it was, and it will it was it and because of a programming mistake, and so I added this here that is to this session. I hope that we will be able to make a detailed presentation next year. And so when we look at the cross-section systematic comparison of the schizophrenia and the OCD features, and actually Pyroski calls it
seanslı bir nitelik
and
kazanıyor.
and sometimes it can be an obsession,
Normalde iyi kötü
as we all know that
saçma bulacağı bir şey
it is something that the subjects can find silly, and however, together with the DSM fight, non-insightful, uh, non-insightful
bize
opinion, and
düşündürtüyor.
it solves why
Şizofreniyi
should be
gördüğümüz
the schizo-obsessive, and so actually, and so they are not random coexistence, and schizophrenia and spectrum disorders are more common in the group with patients who have the OCT, and cannot be explained by chance association, and OCD is related with the prognosis, and the treatment approaches may vary. And actually, we see that the more depressive symptoms, more suicidal attempts, earlier age of onset, increased hospitalization, worse performance functions and quality of life, and they have greater occupational and social impairment. More cognitive loss is observed, and actually we see that there are different studies, especially and when the insightfulness loss of work ability can be also shown, and and actually the schizo obsessive compulsive symptoms, and so actually we see obsessive compulsive symptoms, and and actually whether the obsessions and the delusions lie on a spectrum, or are they categorically distinct from each other, or can the clinicians distinguish a poorly insightful, non-insightful obsession from a delusion? And so is this a true epidemiological comorbidity, or do these symptoms expressed together indicate a more serious disease? And actually, so this the non-insightful OCD, and so schizo-obsessive, is this a subtype of the schizophrenia, and or is it another group that needs to be taken more seriously? And actually, so what we can say, and so we need to also distinguish obsession and the delusion from each other. And we have a table here, as you can see. And so in the obsessions, thoughts, images and impulses, and delusions, it is the thoughts. And there are overlapped areas, and obsessive thoughts, and actually, so we may need to talk whether it is obsession and delusions. And however, from the clinical perspective, it poses and difficulty for us, and it is the Bermanzo's. And so, and actually, with obsession as a form, but psychotic and delusional in content, and the loss of insight into simple obsessions. And here it's a nice diagram here, as you can see. And so on one side of the OCD, we have pure OCD. And so on one side, low insightful, poor insight, psychotic features. And however, schizotypical personality disorder close to the central line, and together schizophrenia and OCS, and schizophrenia plus OCD, then finally ending with the schizophrenia itself. And so in regard to the treatment, so actually switching to safer antipsychotics may be considered. Ariprazole, amisulfite, and ziprasidone have lower risk in terms of the OCS, and however, we need to take into consideration the other. And this is this atypic antipsychotic monotherapy and serotonin inhibitor may be added, and if no response, and another atypical antipsychotic can be switched to. And if still no response, then on the step 4, the typical antipsychotic SSRI or clomipene, and on the stepwise clozapine, and on the stepwise clozapine plus SSRI. And you see here there is all algorithms of treatment, and of course with the lower OCB inducing use of less OCB inducing medications are, of course, suggested. And so these are the pyroskis, the only may with the book obsessive compulsive symptoms in schizophrenia. And so the Pyroski is schizo-obsessive disorder, and the other one is obsessive compulsive schizophrenia. They are two actually guideline books or the very used handbooks